How to negotiate medical bills and debt. Real results. Medical bills and debt can be a major source of stress for many people. The high cost of healthcare, unexpected emergencies, and insurance complications often lead to financial strain. However, there are real and effective ways to negotiate medical bills and reduce or even eliminate the debt you owe. Understanding your rights and taking the right steps can make a significant difference in your financial situation. The first step in negotiating medical bills is to review all the statements and bills you receive. Make sure you understand what each charge represents. Sometimes errors occur, such as duplicate charges, incorrect procedures, or billing for services you did not receive. If you find any discrepancies, contact the billing department immediately to correct them. This can sometimes result in a reduction or removal of the bill. Next, it's important to know your rights as a patient. Many hospitals and healthcare providers have financial assistance programs that can help reduce the amount you owe. These programs may be based on income, family size, or other factors. You should ask about these options when you receive your first bill. Some providers also offer payment plans that allow you to pay off the debt over time without paying the full amount upfront. If you are unable to pay the full amount, you can try negotiating the balance directly with the provider. Many healthcare facilities are willing to settle for less than the full amount, especially if you are experiencing financial hardship. Be prepared to explain your situation honestly and clearly. You may also want to ask if they accept a lump sum payment in exchange for a reduced balance. Another strategy is to work with a medical billing advocate or a credit counseling agency. These professionals specialize in helping patients navigate the complex world of medical billing and can often negotiate on your behalf. They may also help you understand your insurance coverage and ensure that you are not being charged for services that should be covered by your plan. It's also important to be aware of the statute of limitations on medical debt in your state. In some cases, after a certain period of time, the debt may no longer be enforceable. Knowing this can give you more confidence when negotiating or disputing a bill. In addition, if you are dealing with collections agencies, you have legal protections under the Fair Debt Collection Practices Act. This law prohibits collectors from using harassment, false information, or unfair practices to collect a debt. You can send a written request asking them to stop contacting you, and they must comply unless they plan to take legal action. Finally, always keep records of all communications, including emails, letters, and phone calls. This documentation can be useful if you need to dispute a bill or file a complaint later on. It also helps you track the progress of your negotiations and ensures that you have proof of any agreements made. Negotiating medical bills and debt is possible with the right approach and knowledge. By understanding your options, communicating effectively, and seeking help when needed, you can significantly reduce the financial burden of medical expenses. Taking these steps can lead to real results and help you regain control of your financial future.